Hi everyone, and welcome back to the Baby Channel. Today we're diving into baby reflux. It's incredibly common in newborns and infants. But even though it's common, it doesn't make it any easier. Dealing with a fussy baby can be really tough. Don't worry, you are not alone. So many parents go through this. Baby reflux, also known as GERD or gastroesophageal reflux, happens when food backs up from a baby's stomach. This can cause your little one to spit up, cry more than usual, especially during or after feedings, and even have trouble sleeping soundly. It's enough to make any parent worry. The constant spit up, the crying, the feeling of helplessness. It's a lot to handle. You might be feeling overwhelmed, exhausted, and maybe even a little scared. And that's okay. Remember, you are doing a great job. It's completely normal to feel this way. The important thing is that you're here, seeking information and support. And that's exactly what I'm here to give you. Throughout this video, I'll be sharing some tried and true methods that have worked wonders for other parents. And hopefully, they'll bring you and your little ones some much-needed relief. The good news is that most babies outgrow reflux by the time they turn 1, and there are things you can do to ease their discomfort and yours in the meantime. So take a deep breath, grab a cup of tea, and get ready to learn about some effective ways to manage baby reflux. Remember, you've got this. Now, before we talk about solutions, let's make sure we're on the same page about what to look for. Recognizing the symptoms of reflux is the first step towards helping your little one feel better. One of the most obvious signs is spitting up or vomiting, especially after feedings. It's important to remember that all babies spit up a little. It's part of their developing digestive system. But if your baby seems to be spitting up a lot more than usual, or if it's forceful and projectile, that could be a sign of reflux. Pay attention to how your baby behaves during and after feedings. Are they arching their back, fussing, or crying? Reflux can cause discomfort and pain, so your baby might show their discomfort through their behavior. While spitting up is a common symptom, reflux can also manifest in other ways. You might notice your baby seems uncomfortable or gassy, especially after meals. Some babies with reflux hiccup frequently or have a chronic cough. They may also have difficulty sleeping or wake up frequently throughout the night. Keep in mind that every baby is unique, and what might be a sign of reflux in one baby might be perfectly normal for another. That's why it's so important to pay close attention to your baby's individual cues and trust your instincts. You know your baby best. If you're concerned about their behavior or suspect they might be experiencing reflux, don't hesitate to reach out to your pediatrician. They can help you determine if reflux is the culprit and recommend the best course of action to ease your baby's discomfort and set your mind at ease. Remember, you're doing great, Mama. Just by being here and learning as much as you can, you're already taking amazing care of your little one. Let's talk about practical steps to manage your baby's reflux. Focus on diet, yours if breastfeeding, and your baby's if formula feeding. Certain foods in your diet could contribute to your baby's reflux. Common culprits include dairy products, caffeine, spicy foods, and acidic fruits. Eliminate one thing at a time and see if you notice a difference. Keep a food journal to track what you're eating and your baby's reactions. Every baby is different, so it might take some trial and error. Section 2. Formula feeding strategies. If you're formula feeding, there are a few things you can try as well. First, make sure you're using the right formula for your baby's age and needs. If your baby is struggling with reflux, your pediatrician might recommend switching to a specialized formula. There are formulas designed specifically for babies with reflux, often labeled as gentle, sensitive, or anti-reflux. These formulas are typically thickened to help keep the milk down, and some contain ingredients that may be easier for your baby to digest. When preparing the formula, always follow the instructions on the packaging carefully to ensure the correct concentration. And don't hesitate to reach out to your pediatrician if you have any questions or concerns about choosing the right formula for your baby. Section 3. Patience is key. Making dietary adjustments can make a real difference in managing your baby's reflux. But remember, it's not always an instant fix. It might take a little time to find the right balance and see noticeable improvement. Be patient with yourself, be patient with your baby, and celebrate the small victories along the way. And don't forget, you're doing a fantastic job. If you're finding this video helpful so far, give it a thumbs up and subscribe to the channel for more tips and support on your parenting journey. We're in this together. Section 1. Upright and alert. Now that we've covered dietary adjustments, let's move on to some practical positioning techniques that can make a world of difference in managing your baby's reflux. One of the simplest yet most effective things you can do is to keep your baby upright during and after feedings. Think about it. When your baby is lying down, gravity works against them, making it easier for milk to flow back up. But when they're upright, gravity becomes your ally, helping to keep that milk down where it belongs. Aim to hold your baby at a 30 to 45 degree angle during feedings. You can use a nursing pillow, or even just a regular pillow on your lap to help support them in this position. And don't worry, you don't have to hold them perfectly still. Gentle rocking or swaying can actually be soothing for your little one. Section 2. The power of gravity. After feeding, continue to hold your baby upright for at least 20 to 30 minutes. This gives the milk time to settle in their tummy and reduces the likelihood of spit up. I know it can be tempting to lay them down for a nap right away, especially when you're feeling exhausted yourself. But trust me, those extra few minutes upright can make all the difference. This is a great time to engage with your baby, make eye contact, sing a lullaby, or just enjoy some quiet cuddle time. Section 3. Burping basics. Burping your baby regularly throughout and after feedings is another crucial step in managing reflux. Air bubbles trapped in their tummy can put pressure on their little digestive system, making reflux more likely. Gently pat or rub your baby's back to encourage those air bubbles to come up. You can try different positions to see what works best for your little one. Over your shoulder, sitting upright on your lap with their chin supported, or even lying face down across your lap. Don't be surprised if a little milk comes up with the burp. That's perfectly normal. Just have a burp cloth handy to protect your clothes. And remember, every baby is different. Some babies need to be burped frequently, while others are perfectly content with just a burp or two. Pay attention to your baby's cues and adjust your burping routine accordingly. Section 1. Creating a safe haven. Now let's talk about creating a sleep haven that's both comfortable and safe for your baby, especially if they're dealing with reflux. You're probably already familiar with the importance of putting your baby to sleep on their back. It's the safest position to reduce the risk of SIDS, and that holds true even if your baby has reflux. However, you can still make some adjustments to their sleep environment to help minimize reflux symptoms. Start by ensuring your baby's crib mattress is firm and flat. Avoid using soft bedding, pillows, or stuffed animals in the crib, as these can pose a suffocation hazard. Keep the room at a comfortable temperature, as overheating can make reflux worse. A cool mist humidifier can add moisture to the air, which is especially helpful during dry winter months. While you want to keep the sleep surface flat, you can slightly elevate the head of your baby's crib to help reduce reflux. You can do this by placing a firm wedge pillow under the mattress. Make sure the wedge is securely placed and doesn't create a gap or uneven surface. Avoid using pillows or blankets to prop your baby's head up, as these can be dangerous. Elevating the head of the crib helps gravity work in your favor, keeping stomach acid down and reducing the likelihood of spit up during sleep. Aim for an incline of about 30 degrees, but always consult with your pediatrician to determine the appropriate angle for your baby. You might have heard that side sleeping can be helpful for babies with reflux. While it's true that side sleeping can sometimes reduce reflux symptoms, it's important to note that it also comes with an increased risk of SIDS. If you're considering side sleeping for your baby, talk to your pediatrician first. They can assess your baby's individual needs and advise you on the safest approach. If your pediatrician does give the okay for side sleeping, make sure your baby is positioned correctly. Their head should be slightly tilted back to keep their airway open, and their bottom arm should be extended forward to prevent them from rolling onto their tummy. Remember, always prioritize safe sleep practices to create the most secure and comfortable sleep environment for your little one. We've covered a lot today. From dietary changes to positioning techniques and creating a reflux-friendly sleep environment, there's so much you can do at home. But it's crucial to recognize when to seek medical advice. Some red flags should never be ignored. If your baby shows these symptoms, contact your pediatrician immediately. Poor weight gain is a major concern. Reflux can affect feeding and digestion, leading to poor weight gain. Vomit that's green, yellow, or contains blood needs immediate medical attention. Beyond these specific symptoms, always trust your instincts as a parent. You know your baby best, and if something doesn't feel right, don't hesitate to seek medical advice. If your baby is excessively fussy, cries inconsolably for extended periods, or seems to be in pain, it's essential to reach out to your pediatrician. Remember, it's always better to err on the side of caution when it comes to your baby's health and well-being. Your pediatrician is your partner in navigating the challenges of parenthood, and they're there to support you every step of the way. When you do reach out to your pediatrician, be prepared to provide them with as much information as possible about your baby's symptoms. Keep a journal to track the frequency and severity of their reflux, any dietary changes you've made, and any other relevant observations. Don't be afraid to ask questions and advocate for your baby's needs. Your pediatrician will likely perform a physical exam and may recommend further testing to rule out any underlying medical conditions. Based on their assessment, your pediatrician will recommend the best course of action to address your baby's reflux. This might involve medication to reduce stomach acid production, lifestyle modifications, or a combination of both. Remember, effective communication with your pediatrician is essential. Be open and honest about your concerns, ask questions, and don't hesitate to seek clarification if needed. Working together, you can develop a plan that brings your baby the relief they need and gives you peace of mind. We've covered a lot of ground today, from recognizing the signs of reflux, to exploring dietary adjustments, positioning techniques, and creating a reflux-friendly sleeping environment. And while it might seem overwhelming at times, remember that you're not alone on this journey. Baby reflux is incredibly common, and with patience, persistence, and the right strategies, you can help your little one find relief and thrive. Remember those key takeaways. Paying attention to your baby's cues, trying different strategies to see what works best for them, and always trusting your instincts. You know your baby better than anyone else, and you're doing an amazing job. As you navigate the ups and downs of parenthood, remember that it's okay to ask for help. Reach out to your pediatrician, family, friends, or a support group. You don't have to do this alone. And in those moments when you're feeling overwhelmed, take a deep breath, cuddle your little one close, and remember that this phase too shall pass. Most babies outgrow reflux by their first birthday, and in the meantime, there are so many things you can do to ease their discomfort and yours. If you found this video helpful, please give it a thumbs up and subscribe to the channel for more baby tips and tricks. And speaking of helpful tips, are you looking for the ultimate trick to get any baby to sleep fast? Don't miss out. Check out this video right here or click the link in the description below for more details. It's packed with soothing techniques and sleep strategies that will have your little one drifting off to dreamland in no time.